Hello and welcome. Today we're exploring the remarkable impact of vitamin D on our health. From preventing diseases to transforming lives, vitamin D's role is pivotal. Yet there's so much controversy surrounding how much vitamin D we actually need. From sunlight to supplements, let's explore the most effective ways to optimize our vitamin D levels. Let's start with Michelle's story. As an African-American woman, she struggled with fibroids most of her young adult life. Her doctor told her that her fibroids were so large that getting pregnant would be impossible and suggested removal of her uterus. But thankfully, that wasn't the end of her story. Seeking a second opinion, Michelle turned to a natural medicine doctor who tested something often overlooked: her vitamin D levels. Shockingly, they were at a level of 7, the lowest her doctor had ever seen. After a high-dose vitamin D supplement regimen, not only did her fibroids begin to shrink, but she also conceived her first child by the following year. Michelle's experience wasn't just a relief, it was a revelation of the power of vitamin D. This brings us to a crucial lesson: don't guess, test. In this video, we will discuss 5 simple steps to better understand and manage your vitamin D levels effectively. But first, let's review a few key concepts to better understand how we get vitamin D in the first place. Vitamin D inputs come from multiple sources, such as food, sunlight, and supplements. Foods like salmon and fortified milk can provide us with some vitamin D, but often not enough to meet our needs. Sun exposure also plays a critical role. Our skin synthesizes vitamin D when exposed to UVB rays, particularly between the hours of 10 a.m. and 3 p.m. However, factors like skin tone, where darker skin synthesizes vitamin D slower than lighter skin, and geographic location can significantly affect this process. Other factors like season, clothing, sunscreen, time spent in the sun, and cloud cover can also impact vitamin D production. Meanwhile, those with outdoor careers, like construction workers, or those with traditional lifestyles, such as the Maasai tribes who are often outdoors, manage to maintain average vitamin D levels around 43 nanograms per milliliter or higher. This illustrates the challenge for the rest of us, particularly those in less sunny climates or with indoor occupations. Because of the variability of vitamin D inputs, supplements are a very important piece of the vitamin D solution. Vitamin D3 supplements are affordable and widely available in several different forms, including gels, tablets, drops, and creams. Just to note, however, that although vitamin D toxicity is rare, as with anything, you can get too much. That's why there are certain steps essential to ensuring you have found the right dose of vitamin D and the right routine for the levels you are trying to achieve. Now let's get into the 5 steps I mentioned earlier to help better understand and manage your vitamin D levels effectively. Step 1. Test your current vitamin D level. We hear many people talking about how vitamin D is good for you, what it's good for, and how many diseases it can help with. But what do you do with that information? How much vitamin D do you need? Complete a vitamin D test, either through a healthcare provider or a home test kit. Why do you want to test? Because to know where you need to go, you need to know where you are. You cannot blindly supplement. That approach just does not work for everyone. Step 2. Determine your target level. What should your vitamin D level be? According to Grassroots Health, whose scientific panel consists of several of the world's leading vitamin D researchers, the general population should aim for a vitamin D blood level of 40 to 60 nanograms per milliliter. Some individuals with certain conditions may benefit from even higher levels, such as 80 to 100 nanograms per milliliter for certain autoimmune diseases, cancers, or cluster headaches. Always consult with a healthcare provider who is knowledgeable about vitamin D to safely manage higher levels and monitor for potential toxicity. Step 3. Calculate your vitamin D intake. Use a vitamin D calculator to determine your estimated daily dose of vitamin D based on your current level, target level, and weight. For those needing rapid improvement, a loading dose might be necessary, which helps achieve target vitamin D levels more quickly by taking a higher dose for a short period, followed by a maintenance dose taken daily to sustain those levels. Now let's go over an example of how to use the vitamin D calculator. Let's say you weigh 140 pounds with a starting vitamin D level of 20 nanograms per milliliter. and your target is 60 nanograms per milliliter. Initially, you might take a loading dose of 25,000 international units daily for 10 days to quickly raise your levels, followed by a maintenance dose of 8,000 international units daily to sustain those levels. Step 4. Implement your vitamin D routine. With your dosage calculated, start your vitamin D regimen. This might include supplements, increasing intake of vitamin D-rich foods like salmon, eggs, and fortified milk, or safely increasing sun exposure, taking care not to burn. It may also require increasing the intake of other nutrients such as magnesium or vitamin K2. Step 5. Retest and adjust. Testing your levels again is vital to see how effective your regimen has been. Wait 2 to 3 months to see if you reached your target. If so, great. Keep taking the dose of vitamin D you have been taking to maintain that level. If you did not reach your target, adjust your intake as needed based on your latest results. Remember, everyone's response to vitamin D can vary, so ongoing monitoring is crucial. For example, in an analysis of 5,442 grassroots health participants who completed at least 2 vitamin D tests, while 2/3 reached a vitamin D level of at least 40 nanograms per milliliter on their second test, 1/3 remained below the 40 nanogram per milliliter target level, indicating a need for a higher dose. Never assume you are getting the right amount of vitamin D through supplements. Factors such as age, size, color, or even seasonal changes can affect your levels. And remember, it is also possible to take too much vitamin D, thus creating the risk for toxicity. This is why experts suggest testing a minimum of twice per year to ensure target levels are achieved and maintained, as levels tend to be highest at the end of summer and lowest at the end of winter. In addition, if you are taking a loading dose or have been sick, you should probably test sooner. In conclusion, do not wait to prioritize vitamin D. Start today and see how this powerful vitamin can support your journey to better health. If you would like to join the Grassroots Health D Action Project, learn more by visiting www.grassrootshealth.net, where you can also find the vitamin D calculator. Remember, by learning and sharing, you become a part of the movement. Join the conversation and share your story using hashtag #VitaminD4Health. If you found this information helpful, don't forget to like, subscribe, and hit the bell icon for more health tips. Share this video to spread awareness and help others take charge of their health too. And remember, moving research into action isn't just our mission, it's a commitment to your health. Together, we can make informed health choices not just possible, but practical and widespread. Stay healthy, stay informed, and see you in the next video.